Our campaign kickoff. You all just noted that we are recording this webinar to serve as a resource for future reference. But thank you all so much for joining this kickoff call for our first campaign of the year, Be a Hero, Make a Plan. I know some are still joining, and that is absolutely okay. But I'm just going to go ahead and get started just because we have quite an agenda planned for this call. So before we get to it, just some quick housekeeping items. Please mute your lines as we will be featuring many speakers today, many wonderful speakers. And we just want to make sure we don't have any background noise or any feedback that can be picked up on the call so we don't get any interruptions. If you have any questions, please enter them into the chat. And we also invite you to please turn on your cameras. Certainly no requirement to do that, but we do love to see your faces and real-time reactions. And just a reminder that we have an evaluation to complete at the very end. So please, I'll give another reminder because we definitely want your feedback. We want to give a big thank you to our sponsors for our Patient Action League, Johnson & Johnson, Bristol Myers Squibb, and Grail, for helping to make this campaign possible. And today, well, actually, before we get to the objectives of today's call, we'd love to hear some quick introductions. If you all don't mind sharing just your name, where you're tuning in from today, and have you participated in the Be a Hero campaign before? Just enter that into the chat, and we just really love to see where you all are calling from. All right, I'm seeing some first timers. Yes. Good to see a nice smattering of where everyone is. Great. Thank you, guys. All right, so today, what are we doing here? Well, this is our campaign kickoff for Be a Hero, Make a Plan. And we're gonna just quickly go through some of these items to start, give you some background on the campaign. Why do we focus on care planning? Why do we think it's important? Why have we built this campaign around it? We're gonna tell you some of the actions that you all can do to help spread the word about care planning. And then we're also gonna hear from some of our volunteers, what we're calling our care planning advocates and experts, hear from them directly to answer any questions that you guys may have, as well as hear some of their experiences about what they've done to really bring this campaign to their communities. And last but not least, we'll answer some of your questions. And so we'll go ahead and get started here. And I'm going to turn it over now to my teammate, Mary McKira, who is helping really lead this campaign, and she's going to walk you through, what this campaign is about and some of the actions that you all can do. So Mary, please take it away.
Hello, everyone. Thank you all again so much for joining this call. We're really excited about getting into our third year of the Be a Hero, Make a Plan campaign. And we initiated this campaign, so a bit before my time, but back in 2020, we all found ourselves one way or another impacted by the pandemic. And so many people had shared their frustrations around not knowing how to care for a loved one and be able to make really important decisions, especially if they were not able to be physically present while they were receiving care. And while care planning has always been an important aspect of care and an important part of preserving choices that we make and decisions that we want for our care, it became even more abundantly clear during the pandemic. And if COVID has taught us anything, it's that our lives really can change at any given moment. Our health is not guaranteed, and we should really try and be prepared for when anything happens. So this is really the premise for the Be a Hero campaign. So to start, just with some basic background, the goal of this campaign is to normalize care planning. And basically that just means we want to make it easy to talk about care planning. And we have quite a few resources for everyone to dig into that we're really excited to share with you all. Our target audiences for this campaign are the same as last year. While we believe everyone absolutely should have a care plan, we want to be very intentional and specific with the types of audiences that we're reaching. So we're focusing in on young adults, limited resource populations, and patients and caregivers. So with the resources that we have an updated campaign toolkit. And I will show you all how to navigate and find each of these resources. So we have an updated campaign toolkit. We have a community outreach checklist, which is helpful to help you all identify the different types of organizations and groups that you're able to communicate with. And we also have a care planning conversation guide that we've integrated into the toolkit. We took a lot of your feedback from last year and wanted to make sure that we offered something a bit more tangible. So you're able to refer back to a quick guide about how do I answer certain questions related to care planning, or how do I make people care about this, or how do I communicate with people in my community about the importance of care planning. So we wanted to go ahead and create that resource for you all. And I will quickly show you all how to navigate through this, how to find the different resources on the website. So let me quickly share my screen. Okay, can you all see my screen? Yes, perfect. So if you're on the website, you can go to, so there are two different ways you can get through it. So the easiest way is to go to Get Involved, join a campaign, hit Be a Hero, make a plan, get started. This will take you to our campaign page directly. And here you'll have access to all the different campaign resources. So you are able to take a look at our campaign toolkit here. And you're also able to scroll down and access our care planning guide and our community outreach checklist at the very bottom. There are also other resources as well, but these are the main ones we would like to highlight for this month. So with the toolkit, when you click here, this will take you to where you're able to find all the different actions that you're able to take this month. So I won't get into too much detail, just high level. So we're going to go ahead and go back to the PowerPoint presentation and share exactly what is listed on the toolkit. So on this toolkit, you will have a detailed overview of what the campaign is. You'll also have a list of actions that you're able to take just based on whatever your comfort level is. And just to give you some ideas of what you're able to do throughout the month and during our dedicated week of action. The toolkit will also hyperlink out to different tools to support you in different actions where appropriate. We also offer sample social media posts. We encourage you to personalize it as much as you can. You of course do not have to use any of the social media posts or templates. It's just something that we offer to help you along. There's also a conversation guide that we mentioned earlier about how to navigate these different conversations within your community and with your loved ones, and how to host a workshop. And we will have a separate call for that as well next week. And each campaign, as many of our returning advocates know, we have a dedicated week of action. So next week, beginning next week from Monday to Friday, You can take one action per day, and we've specified the different actions you're able to take. So a young adult outreach day, connecting with your community, offering direct help to 1 or 2 people within your network. That Thursday, attending the Legend training to just help you lead. So it's going to be centered around helping you lead a focus group and helping you identify the different care planning gaps that may exist within your community. And we have our social media day of action. So every April the 16th is National Healthcare Decisions Day. And on that Friday or that Saturday, however you like, you're able to just fill in. We have a fillable graphic that you're able to use and share why you have created a care plan and post it on social media with the hashtag Be a Hero, Make a Plan. And, you know, when while this dedicated week of action isn't a restrictive engagement timeline, we just wanted to offer this so that you're aware of, you know, when most people will likely be participating in the campaign, and it may provide an extra layer of focus if that's helpful, so you can feel a little bit more connected to the campaign and see all the different posts that people may be sharing as well. So next, we have our community outreach checklist that we mentioned a little bit earlier, which is also located in the resources section on our Be a Hero campaign webpage. And this is just going to help you keep track of the different groups and people that you connect with in your community. We also have our care planning conversation guide, which was mentioned earlier, just to help you navigate these different conversations, which is also integrated into our toolkit. So this is going to be a really great way to share, you know, how the different levels and the different ways that you can engage on the campaign. So one of the best and easiest things you can do is to simply share the care planning guide. And there are 3 different campaign levels that you can participate in. So as you know, a play on the hero word, there are different actions for you to be a sidekick on the campaign, a hero on the campaign, or a legend. And with the sidekick, it's going to be sharing the care planning resources on social media. With the hero level, sharing via email our care planning guide to people or groups that you're familiar with, or writing a letter to the editor. And the legend status, hosting a care planning workshop or focus group. And again, we will have a separate discussion on that next week. So without further ado, we're actually really excited because we're going to be hearing from 3 of our care planning advocates, legend status volunteers, and wanted to share really quickly that we actually selected these particular volunteers because they were incredibly engaged in our campaign last year. They did tremendous work in their communities, and we're so excited for you all to hear the different types of actions that they took in their community to help bring awareness to care planning. So we have Tony K. Mangskow, Brittany Sullivan, and Jamie Stokely. Thank you all so much for hopping on and offering your time and your expertise to share a little bit about what you've been doing in your communities. So the first question, I'm going to just go in order on who's on my screen. I'm going to direct to Brittany. So how did you bring the Be a Hero campaign to your community?
Hey, everybody. Happy to be here. Thank you so much for having me. And so I kind of jotted down some notes. So the Be a Hero campaign was my first campaign that I was introduced to when I first started volunteering with NPAF. And I never really fully understood what it was to be a caregiver. My mom was a caregiver to my dad while he was suffering from a terminal illness, but like I didn't understand her roles and responsibilities that she was tasked with. So at the time that I started volunteering, my grandfather had just been diagnosed with Alzheimer's, and my grandmother took over as the caregiver for my grandfather, and she was very concerned about, she was struggling to find resources and support, and she was also having trouble communicating with him and trying to figure out what he needed. So I thought it was a great opportunity to introduce her to our Be a Hero campaign. And I sat down with her, and we put together a care plan for herself as well as for my grandfather. And I explained to her that it's very important to understand that a care plan is not a will and testament. It's separate from that. So it's basically how you would want to be treated, things that you need if you are unavailable for any circumstance. So I created a care plan for myself, and this helped me to kind of understand the importance of having a care plan, because that's when I started to realize, I never thought that watering my houseplants and taking care of my dog were big issues that are important to me. And it doesn't sound like a really big issue, but when it comes down to it and you're stuck in the hospital for 3 days, you want to make sure that those things are taken care of. So that really helped me a lot. So what I did was I made paper copies of the care plan document, and I passed them out in my community to my friends. I passed them out to my family members, my coworkers, my bosses. And I created a Zoom session, because at the time we were still in the midst of COVID and we couldn't really have in-person meetings. So I made windows on Zoom, and I sent those links out to family and friends and shared it on Facebook. And I told people if they had any questions that they could just hop on a Zoom with me. And I would sit there and kind of wait for people to float in, and then they'd ask me questions, and I'd walk them through their care plan. But I really enjoyed the social media aspect of the campaign. And I decided to make a TikTok, which was really cool because I was able to target a younger population of people, people that are in college and in high school. They're not really thinking about a care plan, and I think everybody should definitely have one. I'm really excited about engaging in the campaign this year, specifically because I have assumed a caregiver role for my fiance. He's struggling with an illness that's been long-term, and I'm hoping to help him kind of put together his care plan. And also I've been more engaged with my community in Tallahassee since things are starting to open back up. So I'm really excited to do some in-person meetings and maybe meet with some legislators and stuff like that. So it's really what I got. Thanks for letting me share.
Thank you so much, Brittany. Well, that's a lot that you've got, and that is incredible. I'm gonna go to Jamie. Same question. How did you bring the Be a Hero campaign to your community?
Hello, my name is Jamie. Brittany, you did an amazing job on your campaign. I never thought about TikTok, but I mean, I'm sure that was a lot of fun. How I brought the care plan into my community, I went out to different organizations, and I own Helping Hands of the Cape Fear, which is a home care agency. And within the home care agency, we go into different homes and in different settings and provide non-medical care. And I realized at that time that this simplified care plan was like a non-medical document. So I went out to doctors, and I mean, I was kind of like a care planning, I had a care planning fiasco, you guys. I went everywhere because it was like amazing how this simplified care planning helped us in, the business that I am in. When it comes to home care, everyone thinks about medical, what's the diagnoses, what type of medications you need, but no one talks about the simple things like where my keys will be, or if I need my remote to be on the left side or the right side, or if I like my water hot or cold. Those things matter. And knowing that and showing the empathy that we do within the company, the care plan, I proposed it just like that. And it drew so many communities, even to Helping Hands, just showing that type of empathy and just letting people know, look, no matter the age that we are, we need a care plan in place. And it's just this simple. I realized that people were afraid of that medical care plan. Like, no, those are too many papers. I don't know what that means. Is this legal? Is this not legal? And you guys dealing with the elderly, it gets a little bit tougher because they want to know everything They want to know everything. I love them, but they want to know everything. What is this? What is this word? This is bold. Are you trying to take me out there to that nursing home? And I'm like, no, 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 no. This is a simplified plan that actually help us help you. What is it that you need? And they'll go on and on. Well, back in the day, I did like my watermelons cut, vertically instead of horizontally. And I'm like, okay. I mean, and it was just a cool thing, you guys. So I say get engaged in it. It is not uptight type of meeting. I had to make people comfortable in all these settings. I went from larger organizations like the Rotary Club that I'm in here in Wilmington, North Carolina. I went from that type of setting to Disability Resource Center, to that type of setting, and then more of a community setting. And within all those settings, I had to bring a different perspective to let everyone know as a whole that how important care planning is and how simple it can be. The plan that NPAF formulated, I mean, it was just incredible. I was looking through it and I'm like, this is actually fun. And, I didn't realize I needed to tell someone these things about myself. And so I say, you guys just get engaged in it. It's very, very rewarding. Share it with your family, share it with your friends, your community, and your jobs. Even the doctors that want, if any doctors on a call, forgive me, but even the doctors that, are so, compelled about the medical care plan, I get it. It's definitely a valuable document, but the simplified care planning, you guys, it is the bomb. That's all I got.
Well, again, that is quite a lot. Thank you so much, Jamie. You two have been absolutely incredible in hosting so many different types of talks and webinars in your community, and I'm so grateful. We're all very grateful that we have an opportunity to hear from you all about your experiences. And of course, we have the wonderful Tony K. Mangskow. Same question: how did you bring the Be a Hero campaign to your community?
Yeah, thank you for the opportunity to share some information with everybody. I've worked in the medical field for quite a number of years, and I've known the importance of having these types of conversations. But yet, until it hit my own family, where I was becoming caregiver for my mom, dad, I have a disabled brother, adult kids with health issues. I don't think that I slowed down to say, hey, this applies to me too. And our family got together and we had some really important conversations when our parents started to get very sick, and they'd be in and out of hospitals or skilled nursing. And there were times when they were not able to speak for themselves. So how I viewed the Be a Hero, Make a Plan campaign is, how can I share this importance of a topic and present it as this is an introduction to it all. It's not that you're going to jump and do an advanced directive, also known as a living will, but how important it is for families and communities to have these kind of conversations. So what I did, I was a social worker for quite a number of years, and I made a list of all the organizations. There are probably between 30 and 40 different organizations that I connected with. And I wanted to reach out to people that aren't visible within our community. And that was something that we're so lucky to have a mayor that served in our state house, and she's familiar with a lot of the issues that come up on homelessness and chemical dependency, mental health, all these things. So I wanted to reach out to people that many of us may not encounter throughout our day-to-day activities. And an opportunity came along around the same time that we were opening up this campaign. And I became a member of something that's known as Age Friendly Olmsted County. That's the county I live in. And it's something that the World Health Organization and AARP have offered to local, county, state governments to become members and create an age-friendly community. And the key issue that I have been advocating for as part of this work group, which is a 3-year commitment, but the main thing is caregiving. And I am determined to make caregiving part of whatever action plan we put in place for our to be an age-friendly community. So I started reaching out and giving presentations and sharing materials to programs for single parents. We have a program in town, it's known as the Jeremiah program. And that's a national program. It's for single moms that want to complete their degree, and it's a supportive environment. And I gave a presentation, I would have done it in person, but COVID, on the importance of having this type of information. And the admission coordinator for our local Jeremiah program included this as part of an admission packet. So everybody will come up with the care plan as part of their admission. And then I also connected with women that are involved in our child protective services, because it's very scary as a parent to have child protection come into your life. And if you're going to have your kids removed, wouldn't you love to have already an idea of who you feel would be a safe individual to be caring for your kids if you're trying to address issues that come up? It could be, again, substance abuse, mental health, domestic violence. So I was able to reach out to some programs that are in place for our child protective services. I connected with an organization in our community that serves men and women that are being released from jail or prison. And they also are including this as part of their admission packet, to where let's have that conversation up front. And then, if something comes up where maybe someone's probation gets violated, they end up back in jail. And hey, they've got a kid that's going to be home from school. Let's have an action plan in place. So that was another group that just opened their door, and they said, this is great information to have. I connected with people that are struggling with homelessness. You'll also hear that referred to as unsheltered individuals. And I connected with one of the volunteers, and then the people that are the directors of this program we have. And we've got a lot of community support. And I did get a hold of our emergency responders. I talked with our mayor, who shared this information with our police chief, our fire chief, and just let them know that, hey, if you run into individuals that are homeless, it's possible that they may, if you're finding that they are under the influence, it's possible within their backpack that they've got this type of information. So just to give a heads up that this is information that we are sharing with people that are unsheltered within our community. I have to say that my church has been very supportive. We're located in a downtown area that is adjacent to a major medical center. And we're really trying to be very supportive of all of the visitors that come from around the world for medical care here. And this, again, it's just information of, hey, here's a packet for you. This is a conversation that you can have, because lots of times people may end up in the emergency room and they may not have even thought about what may happen with things that come up involved with what their wishes are. So I've been invited back to some of these organizations. They've gotten clients. One of them has expanded to another community in our area that I'll be sharing this information for, or sharing this information with. And I'm really excited about the opportunity to infuse this into that age-friendly plan that our state of Minnesota is applying for that. And I'm going to be there just saying caregiving. That is an issue that we've got to address. So thank you for letting me share.
Thank you so much. I think there's been so many incredible takeaways between the three of you. and how you're able to just understand exactly, just assess sort of what the needs are in your community and understand how to do outreach to them. Tony, with your understanding of, okay, I want to focus on the limited resource population and understanding that they don't have consistent, if at all, access to the internet. And so I know you reached out to us last year to have these, the care planning guide printed out, and also have it in I think a waterproof case, and then have the NPAF Be a Hero care planning, or care plan. So they would be able to immediately identify within their backpack or whatever they're carrying, okay, this is how they want to be taken care of. So everyone has that opportunity to make decisions about their care, regardless of what their socioeconomic standing may be. I know we're running up on time, but I do want to ask one more question. So hopefully we got a brief response, and I'm sure we will. We would love to hear if any of you had experienced any challenges when communicating the importance of care planning, and if so, how did you overcome some of these challenges? I'll start with Brittany.
Wow, Jamie and Tony, that was incredible. I gained so much insight from both of you guys, and I'm really pumped now to do this campaign this year. Well, okay, so in terms of challenges for me, I think the thing that confused people the most was the whole will and testament thing. And so when you come to them and you're like, hey, do you have a care plan? Do you have a plan of action in place in case something happens to you? They kind of took a step back and they're like, no, I don't want to think about death. And I would reassure them, and I'm like, listen, this has nothing to do. I mean, it has, it could be death, but it's not only death. It's if you're sick, just like Tony mentioned, like if you're in prison, if something happens to you, you lose your house, or you have to go to rehab or something like that. So once I kind of explained it to them, and I also explained that I did one for myself and expressed the important things that were important to me in my care plan, and kind of showed them what I did, then they were encouraged to go ahead and make their own care plan. So I think kind of bringing yourself into it and saying, well, this is something I did, and it was really important to me, and it helped me a lot. So it might help you. That might be the encouragement that they need to feel motivated to make one.
Thank you so much. That definitely does help. Personalizing it helps people open up a little bit more. Jamie, did you experience any challenges when you were connecting with people in your community about creating a care plan, and how did you overcome any?
As I said, I mean, it wasn't many challenges. Just making sure that you communicate, effectively to each group of people or to each audience. My difficulty or my struggle maybe was, like I said, the elderly, because you had to explain to them exactly what it was that you were, wanting them to partake in, and making it just as simple as the care plan. That's how I overcame that part of it.
Thank you so much, Jamie. And Tony, did you experience any challenges when you were connecting with any groups or any individuals in particular?
Well, I'd have to say, and everybody has said this, COVID, it's like you cannot do that face-to-face. It's Zoom, or you're all masked, and it's not as direct, where it's that establishing that comfort of talking about this. You're talking to them over a screen like we are today, right? But the other thing I want to mention is that in my community, it's a predominantly white community. And there are now some organizations that have established themselves. They've got a great reputation. We've got a group, it's a community engagement response team that we had a person that's the police liaison with the community. And he, along with a pastor of one of our churches, they They also run something that's a barbershop and social services, I think is their program. So I'm trying to connect with people that have that great rapport already established for individuals that are Black, Indigenous, or people of color. Because for myself, coming into a community, at times I've got granddaughters that are biracial. I just think sometimes that you just need to reach out to people that have that established rapport. And our community is changing, and I think that there's more acceptance now. Okay, we got to recognize this. There are some great initiatives that have been brought to our community from other communities throughout the country. So that's one of the challenges for this upcoming campaign that I'm going to tackle. It'll happen.
Amazing. You are all absolutely incredible. Thank you so, so much for sharing your legendary actions, but quite honestly, this is quite legendary what you all have been able to accomplish during the campaign, and how you've been able to continue it throughout the year. And again, so excited to hear what you do this year. No pressure, but we're really excited to hear all about that. So I'm gonna turn it over to Melissa. And we're gonna hear from two of our care planning experts.
All right, so it's my pleasure to introduce the other part of our fireside chat this afternoon, the Rebecca Show. Dr. Rebecca Sidore and NPAF's own Rebecca Kurt, who will have a longer conversation about really the importance of care planning and kind of tease out some things that I think you all would be really interested in. So I'm going to stop sharing my screen and start spotlighting them. And Rebecca Kurt, I'll turn it over to you.
Thank you. And I'm so thrilled whenever Rebecca and I get to be together. The world should have more Rebeccas. We've often featured a couple of Rebeccas, whether it's Rebecca Ango or Rebecca Sidore, but we are affectionately known as the good Rebecca and the bad Rebecca, and you guys can decide who's who. But I'm thrilled to be here. And I'm especially thrilled for Rebecca Sidore to be here, because wasn't this kind of music to your ears? Didn't you need to hear this validation right about now,
absolutely.
Rebecca?
Yes. Absolutely.
So
I'm blown away. I'm amazed.
If our goal is normalizing care planning, you just heard the creativity and the scrappiness of real people on the ground in their communities, right? That are taking their lead in terms of helping make care planning actually be a thing.
Yeah.
So I just love to hear sort of your initial thoughts on what you heard about this. What surprised you about the stuff folks are doing, and how can you use that in your conversations where people are being challenging about what care planning is in academic settings? I mean, it's been taking some hits lately. You know, does care planning really work?
Yeah. I mean, I think what's interesting actually is that I was amazed at the work that all three speakers have been able to do, but I wasn't surprised, because when we talk to patients, they tell us that they do want to get this information from the communities that they trust. And they might only be coming in to see me, say, in an outpatient clinic appointment for a half an hour every 3 to 6 months, but that, you know, it's not necessarily getting the information from where people live, where people are working, where people are socializing, where people are hanging around with people that they trust. So I wasn't surprised. I was just amazed at the reach, and to hear about all the different innovative ways that you all have been like reaching out, either through TikTok, or I was really excited to hear about reaching out to homeless populations. And again, it sounds like maybe Jamie and Tony, we might follow up about that later, to really sort of reach people, and elderly people who may not, you know, maybe unbefriended or socially isolated, who really need access to this information. I also really appreciated, as you were saying, Rebecca, just the normalizing this, that it's not about end of life, it's about quality of life. And I really liked what Jamie was saying, is like the doctors are like, but where's the care plan and where are the forms? And I'll talk about that in a moment. But it really is those things like, do you want to eat chocolate ice cream? Is that what's most important to you? I think that helps people with their care now as well as at the end of life. So it's great that you all have done such an amazing job speaking to your communities and normalizing this for people.
By way of introduction to you, Rebecca, because some folks may not know, can you just sort of tell everybody your background in care planning and how Prepare came to be, just as a way of introducing yourself and why this matters so much?
Yeah, I just, as a little background, and I'll shorten it very quickly, but I started my medical career and I was appalled at how we ask people to make medical decisions, and that we shove consent forms that are written by lawyers in front of people and ask people to make these very large decisions. And so I got very involved in health literacy, working with our libraries and adult learning to try to figure out how could we write these things or present these things in ways that most people would understand, so that they were empowered to make their own decisions. And fast forward in my medical training, again, appalled that so many people were, I would say, unbefriended in our ICUs. People hadn't been given the opportunity to speak up about what was important to them, whether it was about chemotherapy or surgery, much less end of life care. And all the things, again, that we were handing out to people were written at a postgraduate reading level and just were scary. So I have to say I've dedicated probably the last 15 years of my life, which I can't believe, to creating easy to read things about advanced care planning, that are sort of co-created with the community, so that they tell us like what are the words that make sense to them and what kind of pictures would help them, to get engaged, and hoping to make sort of a difference with that. And that's the Prepare for Your Care program, which you may or may not have heard of, but is listed in the Be a Hero.
It is a key feature of Be a Hero is when you want to do more. And Jamie, I loved your, that our care planning resources are da bomb. That'll fit on a button. That's a good, tagline for the campaign. And Prepare for Your Care is sort of, we think of it as a boxed set. Like we've got the prequel, which is our resource, and it's supposed to steer people to prepare, because I think what's so important that Prepare does really well is nobody's conditioned. And this is what Jamie's point was, and Tony's and Brittany's too, is the medical system medicalizes everything. And that's your point, Rebecca, is you were appalled as a physician seeing just how medical it was, when maybe people want to know that they're cared for, and the way their watermelon slices come out, it is really important to them, or whatever it may be. So the opportunity to choose someone as your surrogate is a key part of care planning. We use care planning instead of advanced care planning, as you've heard and seen, because it's part of what can help normalize and take it out of the fray, right? Of like, oh, this is automatically end of life, or I'm dying and I need to do something about, this is about planning for your quality of life and making meaning, right? So I think one of the parts that I love about Prepare is, and you can sort of elaborate on this, it's about prepare. That word is really important, because empower is a loaded word. Patients and caregivers are very rarely empowered, even if they feel confident with the information they know. The medical system medicalizes everything. So Prepare is our opportunity, using the resources you have now in many languages too, which is amazing, helping people to truly prepare for these kind of conversations that aren't the medical ones, but that can be used to make medical treatment decisions, right? So I think that's a big opportunity in terms of normalizing that you were anticipated, and our volunteers have sort of soaked up as like, yes, because it is about the chocolate ice cream or the opportunities for making sure. And I saw we had a guest appearance from somebody's pup, Stacy's pup. So, your pets, all these things that really matter and need to be part of your life planning.
Right.
If we're thinking about encouraging people to sort of name and prepare a surrogate, which is a key part of care planning, like that there's somebody else, what are some of the aspects of prepare that you found particularly helpful? That we call them a backup person, right?
Yeah.
So talk about, surrogate is sort of the medical term for what we mean is your backup.
Yeah. Well, I think, the Be a Hero toolkits do such a great job of giving people the words that they can say to sort of start these conversations. I think when I think about prepare, when we had talked to our communities, they would say, well, it's great that you as a doctor is telling me to go out and choose somebody to make medical decisions for me. But how am I supposed to do that? What am I supposed to say? I don't know. So I think the cornerstone of the Prepare website are these videos that model behavior, model like what you can say, so that people don't have to guess about how am I supposed to bring this up, because it's a scary thing to do. And so we try to sort of provide people with that information about, well, who would make a good surrogate decision maker or care partner, or, what's the word?
Backup.
Backup. I love backup. Who would make a good backup person? With some examples, because it may not be the person who lives in your house. Maybe it's somebody else that would be a better person to do that. And so how do you make that decision about who's the right person? And then when you're ready, how do you have those conversations with some example videos? But I would say in medicine, it's an easy way for us to start those conversations, because people maybe don't get freaked out if we ask them for an emergency contact, because that's kind of what we do. And I would also say that health systems and I would say even clinicians who might be like pushing back and saying, well, I don't have time to do this. Everybody can ask somebody about who their backup is. So I think it's an easy foray into advanced care planning for a lot of organizations and clinicians. And even in the world, we send people off to college and ask them who their emergency contact is. It's kind of like baked into a lot of the stuff that we do. We don't even have to call it like your advanced care plan. It's just like you said, who's your backup in case something goes down?
Yeah. And have you told that backup? I think the other part is not just picking somebody or somebodies to be your backup, but sharing with them. And that's where the care plan work comes in, is helpful. What is your formula for quality of life and meaning in your life, and the things that are important, and making sure that you've shared it so that that backup person and you both are prepared and comfortable. Talking about these and insisting on it, speaking up, as you might say, Rebecca, because there is this hierarchical situation, in a hospital setting where doctors can be pretty formal, and, depending on, it can just be a disproportionate power experience, right?
Yeah.
So that opportunity to prepare.
The most important outcome of our randomized trials of the Prepare program, which of course were secondary quote unquote outcomes that weren't in like the big fancy journal. But the outcome that was the most important to me is that people who were in the Prepare arm of our trials were empowered to speak up during clinic visits. We actually audio recorded like 400 visits, and people who had seen examples about how to bring this up, how to ask clinicians questions and push back a little bit, were the ones that were able to like speak up and talk to people about their wishes and their values and tell their doctors about what was important to them. But I want to get back to the care planning, and I think Jamie said like the simplified care plan. To me, it's not simplified. It's like, it is the key nugget. I think in clinicians, we like, oh, if you don't have that formal signed form, what is this other thing? But I can tell you that you could have that signed form in the checkbox, and we as clinicians will sit around and say, huh, why did they make that decision? And family members who haven't had a chance to have a conversation might say, boy, I have no idea what was going on in their mind when they made that decision. And understanding those things, like what brings, I love that. What are the 3 things that define quality of life, to you? We as clinicians and family members at the bedside could really use that when we're making a whole host of, decisions or needing to make decisions for someone in the clinical scenario.
We're such natural partners, Prepare and NPAF, because of this piece, Rebecca, in particular around speaking up. And you heard from our volunteers how incredibly passionate and eager and pumped up Brittany said, for this year's. So I want to turn and shout out a place that our volunteers spoke up and what it means for the palliative care field and for care planning. There's a new quality measure that this crew has heard about, and Faye Holloway and Sabrina, who are on the phone, Faye and Sabrina both helped make the Do You Feel Heard and Understood quality measure that's coming out next, and now they made it happen. So they were in a room full of doctors and nurses who were all focused in Chicago on coming up with another quality measure around symptom assessment, because everybody always wants to get asked about their pain and their breathlessness and other symptoms, physical symptoms. And it was Faye and Sabrina who said, but wait, let's focus on the communication that's happening and tending to what I say is important to me about the care that I want, instead of what you're going to assume in a checklist is important.
Right.
They turned a whole room around. What does that care and understood quality measure that's coming down the chute mean for your work, Rebecca, and for patients and caregivers everywhere as it happens?
It's huge. And I really can't even underscore how huge it is. And thank you for getting that approved. I've said to people, there have been some arguments about like having some of these quality metrics be, is there an advance directive in the chart, or is there a surrogate on the chart? And I agree that those are, they're proxy measures, but they at least open the door to allow good things to happen, like conversations and things like that. But I would say that when hospitals and clinics start being evaluated, not just on how many advance directives do you have, but how many of your patients feel heard and understood, it's going to force, first of all, it's going to increase advanced care planning, because the only way to sort of know what somebody wants is to start having these conversations. But it really will start to change the conversation. So sadly, as I've learned, again, all the things that I'm a physician, but I'm appalled by so many things in my field. Hospitals don't change, clinics don't change unless there's a financial incentive. But by having this be a quality metric that might be tagged to something, like you might not get a reimbursement if your patients don't think that you heard and understood them, that is huge. That will drive culture change, I think.
I do too. And you know what else is going to drive? Public demand. Because the other thing that changes how practice happens is that the public is feeling confident in saying, and if there's this opportunity, just like Faye and Sabrina requires, like, no, you need to hear and understand me in this room, and you need to hear and understand your patients. I think that's a really key, you hear it from the people who are most likely to benefit. They're the ones who really will make the difference.
Yeah. And I like the, from a marketing standpoint, heard and understood, we could use that for why somebody should do advanced care planning. You can do it like when you go to your doctor, you should feel heard and understood. And as you're saying, they should show up saying, hey, wait a minute. You're supposed to make me feel heard and understood, and I don't feel that way right now.
You got it. Melissa, I know we're running up on time and we may want to take a couple of questions. So Rebecca,
Yes.
as always, thank you. I know this was sort of invigorating for me, and I expect it was for you.
Absolutely.
So thank you for joining us.
Thank
And
you.
let's hear what questions we might have. I'll turn it back to Melissa to help.
Yes, we invite you all to ask any questions of any of our speakers here this afternoon, both Rebecca's and our earlier speakers, Brittany, Jamie, and Tony, and Mary, of course. So if there are questions, you're welcome to unmute or raise your hand and I can call on you, or you can enter them into the chat. Stacy, did you have a question?
Oh, there's a couple, I have so much going through my head, I can't even get it all straight. But I'm a student actually currently, and we're learning a lot about healthcare literacy and just the community, and 90% of people not understanding what's going on when they go and see a physician. And I think it's hard. I don't want to blame the physicians totally. Of course, I'm not one, but you're only given 15 minutes to really see a patient, and that's a problem. And I think sometimes with the HIPAA violations and everything, it's not really fair to have like my mother, for instance, to force her to have somebody like me with her daughter, which I actually know some medical jargon, but why does she have to have her privacy violated by having somebody like me? I think that it would be nice maybe in the future if we could have advocates available. Do you want us to bring in an advocate and have that option available to people? I'm just thinking down the road, because one thing that comes to mind for me is liver transplants. And so many people aren't even aware that if you love somebody, or you're friends with somebody, or you have some sort of a connection and you have the same blood type, you can give up part of your liver and it will grow back in 30 days and you'll be in the hospital 10 days. I mean, people don't even know about that. And I look at like people that I know that are salespeople, and I'm like, oh my gosh, they could totally communicate the importance of being a live donor for a liver. They could do it so well. If we could utilize people and what their skills are, because to expect a physician to be a physician and be like I know it sounds bad, but like a salesperson, and there needs to be more like more middle people, more people that can talk to. That's just my opinion. I don't know. I just want to throw that out there. I'm going to babble on, so I'll mute
Well,
myself.
I've always said that if I could go back, Stacy, that I would get a degree in marketing, because I think some of it is marketing, or saying things in a way that people can hear them. I think one of the things that I'm excited about is that I think health systems are using more healthcare navigators in the system. So like at UCSF, some of the healthcare navigators have been trained to call people and start the conversations about advanced care planning. So I think I'm hoping that will grow. There have been people who use, caregivers in the community, and just as you guys are as well. So I'm hoping that there's going to be more team support, because I think health systems are seeing that actually it helps patients feel heard and understood, and it actually helps their bottom line because patients are, better taken care of.
I even think that mobility is such an issue too. And I see that in my own home, because I have, my mother here who's beginning Alzheimer's, my friend Dan living here who just had a stroke and is now legally blind. And then my boyfriend who just had a stroke and he has mobility issues. And I just see that that it's really a problem, because people can't even navigate like the hallways going from like a parking garage into the hospital. Or I've been witness to patients walking in and saying, oh, you're at the wrong entrance. You need to go all the way back. And we live in New York and it's snowing. And so they're already stressed out by the time they even get into the waiting area, and then to expect them to stand. And it's just, not everybody has me, no offense, but like not everybody has somebody like me that can accompany them around. And it's just really, there should be people available just so that people have their head in the game when they get there, because they're already totally overwhelmed. Like my boyfriend he has lung cancer. And by the time he got from the parking to see the doctor and everything, and then the doctor, English isn't his first language. He doesn't understand anything that it was talked about. And he's like, forget it. I don't even want anything done, because I'm never going downtown and I'm never dealing with that parking. So here's somebody with lung cancer that won't even get treated because he never wants to go back downtown and deal with the parking. I mean, this is the reality of what we're living.
Talk about not feeling heard and understood.
Mhm.
Yeah. Stacy, there are so many examples of, sadly, exactly what you're describing. And I'm so glad the word navigation came up, because that's, of course, a signature issue for National Patient Advocate Foundation in terms of helping patients and families, not just in their medical navigation, but their life flow navigation. And financial and social needs is sort of our big new issue, and how it ties to care planning and supporting people feeling heard and understood, but also having the opportunities for finding the resources in their communities where parking or mobility may be a problem, or copay relief, or all these other things. So these all are intertwined, these issues, just like people's lives are intertwined. And I think there's so much to learn and grow from conversations that we all have like this around how the hip bone's connected to the shoulder bone, through a lot of really important work that we all do, but also the resources that we have and the energy and passion that you all bring, and that Rebecca brings to her research work and her clinical work. It's so thrilling, I think, for the whole team, and I hope for all of you to see the connections we all have and the opportunities we can have to, raise a ruckus around the importance of care planning, the importance of feeling heard and understood, and that patient and public demand for the kind of change we want. That's going to change how practice happens faster than anything else.
I think we have time for one more question. And you can certainly either drop it into the chat or just unmute and ask. And I also just wanted to call out that there is some great discussion, as you mentioned, Rebecca, with hearing navigation. It really did showcase the important role that community health workers, navigators, and advocates play, and how they can really be helpful in perhaps, normalizing care planning and building that demand, right? I think you're right in terms of just how this community outreach is just really important.
Yeah, it's that demand for being heard and understood, but also being responsive to somebody's going to go to the trouble of creating a care plan about what's important to their quality of life. We darn well have to build the systemic resources that help address what people say is important to them. And it's typically much more about their life flow than it is about medical stuff, at the end of life. And that's what I think is the magic bullet to have to explain is, people really are thinking about how can they live their best days, and what does that mean for them with their animals, with their plants, with their things, rather than all of the medical jargon that goes on. And so it's our opportunity as advocates to help tell that story and sort of shout it from every rooftop.
Indeed. Thank you, Rebecca, for being here with us this afternoon. I'm not seeing any other questions pop up. You're certainly welcome to enter them into the chat, and we can get to them and follow up by email. But I do want to take the time to just thank all of our speakers today for sharing your advocacy, your passion here. I'm going to turn it over. We actually went through some of the questions. I'm going to turn it over to Mary McKara, who's really going to close us out to tell you about what you can do today to kick off Be a Hero. So Mary, I'll pass it back to you.
Yes, so there are 3 quick things that you're able to do today. So you can sign up to receive our campaign digest. This is a weekly communication that goes out throughout the month of April. That you just receive exclusive updates on the campaign, get a little bit more insight into what some of your fellow advocates are doing on the ground within this campaign. And you'll be the first to hear about any upcoming workshops or anything of that nature that go on. The second thing that you're able to do is register for our Legend Training Workshop, which is taking place next Thursday at 5 p.m. Eastern, 2 p.m. Pacific time. And you can share a social media post that I will drop in the chat shortly. And just share that the content of the social media post is just that you attended today's Fireside chat, what you learned entering our care planning guide. We are also going to share some key dates with you. So again, next week from Monday to Friday is our week of action. And of course, this is located in our toolkit as well. The Legend Workshop next Thursday, the National Healthcare Decisions Day. You're able to have that editable graphic and share why you're creating a care plan. And you can post that either Friday or Saturday, but National Healthcare Decisions Day is on Saturday. And we're have our campaign wrap-up call at the end of the month on the 28th as well. And thank you all again so much for attending, engaging in the chat, engaging with us and all of our panelists here. And we're so excited to just hear what you all do in your communities and how you're going to further what you've already done the past year or two. And please share all of the advocacy things that you're doing, just so we're aware of what you're doing and we may be able to highlight you next year, whether that's in a newsletter or on something like this. So you, at the end of the presentation, you're going to, a pop-up evaluation is going to come up, and we would love your feedback on this webinar and different ways that you would like to engage in the campaign. But don't click out yet. I'm going to send all the links right now.
Thank you, Mary. And I will help fill the time so she does her magic and puts all those links to the chat. Thank you guys again for spending this afternoon with us. Again, thank you to all the speakers. We really, we hope you were, or the audience, we hope you all were inspired by what you heard today and feel pumped up as much as Brittany does about taking action. We're really excited. You all, our speakers today, you guys just made me beam with pride. I know we spent a lot of time working on that care planning guide, making sure that it's something that can be useful for people. And you guys are really showing us that it is, and it's making a difference. And that is just really, really awesome to see. So thank you all for your advocacy. And I think Mary is dropping the links now. Thank you all again for hanging out with us. We'll share more in our digest, and please don't forget to fill out the evaluation here at the end. Thank you guys. Oh, I see there's the link, Mary, or not the link, but the post Mary just dropped in the chat. Just copy that and either tweet it out, put it on Facebook. We're really glad you guys can join us today. Thank you all.
Bye.
Bye.
Bye, everyone. Thank you.
Bye. Thanks, Brittany.
Thank you.
I'll stay on for just a bit, just so to make sure everyone gets the links.
All right, you guys have a good night. Bye-bye.
You too.
Bye. Thanks, Jamie.